A new clinical trial shows that psilocybin-assisted therapy for veterans with PTSD is not only safe, but can reduce PTSD symptoms in veterans who weren't helped by traditional treatments. The pilot study with 12 veterans included 8 hours of preparation therapy and 2 doses of psilocybin, the active ingredient in magic mushrooms. Integrative therapy followed the drug treatment. Alan Davis, senior author of the study, is director of the Center for Psychedelic Drug Research and Education in The Ohio State University College of Social Work. He said the treatment had no serious adverse side effects and did not increase suicidal thinking or behavior.
And most importantly, we found that there was a significant and large reduction in PTSD symptoms until 1 month after the treatment was completed, with 75% of veterans in complete remission.
U.S. Army veteran Zachariah Collette served a 28-month combat tour in Iraq. By age 25, he was medically retired. His PTSD symptoms included nightmares, feeling constantly on guard, and anger, leading to behavior that had a negative effect on his family. Years of trying counseling and medications didn't help.
Because I was just absolutely tortured by the internal struggle, the internal dialogue, the noise inside my head, and my inability to even just be still.
Now 3 years out from the treatment, he said the psilocybin-assisted therapy had a profound effect on him, his family, and his marriage.
It allowed me the space cognitively to push pause before I chose a reaction. And I like to talk about it in kind of like a training wheel capacity. The first 6 months, maybe to a year, I felt like I had this fantastic set of training wheels while I'm relearning the way to react in situations.
Psychotherapy is a key part of the process. Davis said the trial suggested that PTSD symptoms were lowered even before the drug was given, with a much larger reduction after the psilocybin doses.
The drug session itself is actually just a catalyst for this deep work. It opens up a window for people to perhaps access things that they wouldn't be able to access emotionally otherwise. But what that does is it catalyzes the therapeutic process after, and that's really where the magic happens. It happens in the therapy and in the changes that people start to make in their lives after the treatment's concluded.
I'm Emily Caldwell for Ohio State News.